Hi, so Brianna Lujan, VN49 AM class, and this is video 1, Administering enema. So I'll just go ahead and start. So I'm using a teddy bear, not the best, but it'll do. So first you want to start by checking the order, and you also want to ask the patient what they know about the enema procedure. Some might know what's about to happen, some might not. So it's good to just kind of get them comfortable and ask them if they know anything about it. And if they do, go ahead and just reassure them of what it is that you're about to do. So first off, you want to have the patient lay in a left Sims position, and you also want to have a pad underneath them. So in this case, it's kind of awkward, but so you have them left leg kind of up, so left lie sign, and so you have a pad on underneath here. You want to apply gloves. You also want to fill the enema bag with the correct solution, and you want to make sure the temperature of the water, that should be between 100 and 105 degrees Fahrenheit. You want to expel the air from the tubing. I'll just use my stethoscope. The air from the tubing, make sure it goes all the way out, because you don't want to be inserting air into this patient's body. So you can use a sink or even a pan just to make sure you have all solution up into here. Then you can just put your clamp. And then, so we'll say this is the end of the enema. You really want to lubricate it. You don't want to make this uncomfortable, as it already is going to be for the patient. Just lubricate it up, and then you want to ask the patient to, take a deep breath. And then you're going to have them, as they're taking a deep breath, you're going to gently insert. And you want to go a little bit. Ask how they're feeling. Ask them to breathe again. Take a deep breath. And you want to go in at least 4 inches into an adult. And then you want to ask them, because you probably will feel resistance, just to take a deep breath through their mouth, just to relax their anal sphincter. And then with your container, let's just say this part is the bag, I guess. Once that's in, you want to hold it up at least 12 to 18 inches above the body. And then the bag itself will have between 500 and 1,000 milliliters of solution. So you're going to open the clamp. Open the clamp and then allow the flow into the bowel for 5 to 10 minutes. And you can control the rate and speed. If you go high, it's just going to shoot. And if you just go low, it's just going to take its time. But you want it to go in within 5 to 10 minutes. And if the patient is complaining about any pain, just kind of clamp it. Just clamp the tube. And just ask them to take some deep breaths through their mouth just to relax themselves. Once they don't feel that cramping anymore, you want to continue. So you want to continue until they can either no longer hold it in, or you just empty the whole 1,000 milliliters in there. So when you're done, you're going to clamp it, pull out, and you're going to assist them onto a bedpan or a commode. But they will be holding this in for 20 minutes, or as long as they can, but ideally 20 minutes. The book also says retain for 20 minutes to 2 hours to soften the stool, but I'm not exactly sure about the 2 hours. That seems like a long time to me, but I know 20 minutes for sure. And then when you assist them onto the commode or the bedpan, you want to make sure they're not laying flat. They're kind of up a little bit so that it's not so uncomfortable. And also, if they're on the commode, you want to ask, hey, is it okay if I see the results? most likely they'll say yes, hopefully, and then you want to document the color, the amount that was released, and what the stool looked like. And so afterwards, when you're done with that, you just assist them, help clean them up, put them back in bed, or take the bedpan out, clean them up, and then perform hand hygiene, and then go from there.